Hi friends, today I am going to explain what is the use of N95 mask and what is N95 mask and whether it is useful for healthcare workers for respiratory protection. So first, do healthcare workers need respiratory protection? Yes, healthcare workers can be exposed to patients with infections. So everyday healthcare workers like doctors, nurses, paramedicals will be treating the patients with different kinds of infections like flu and cold, cough, and contagious like tuberculosis, and recently pan epidemic like coronavirus. So whenever the healthcare workers dealing with kind of patients, they are prone to respiratory infections. So for that, the healthcare providers need the respiratory protections. So to minimize exposure to airborne infection agents, healthcare facilities use isolation rooms, negative pressure ventilation, air filtration, and disinfection. So healthcare providers, in order to avoid the airborne infections, they will use the isolation rooms. So presently we are for treating COVID-19 patients, we are using isolation rooms. And negative pressure ventilation, that is, we need separate ICUs which is built up of negative pressure ventilation. And next we need air filtration and disinfection. So the doctors and nurses who are treating the patients, they need the proper air filtration and disinfection. And however, in setting administrative and engineering controls may not adequately protect healthcare workers from contaminated airborne droplets. Suppose doctors and nurses are working in the isolation rooms or negative pressure ventilation, but apart from taking all the precautions while treating the patients, if they are not wearing the protective mask, so whenever they sneeze or the air droplets will be there in the air. So in order to protect the doctors, they need to wear a face mask. So for that purpose, we are using the N95 respiratory mask. Therefore, healthcare workers should use respiratory protection. So in order to avoid the infection from airborne droplets and everything, so we are using the healthcare workers should use respiratory protection. So for that purpose, we are using the N95 mask. So in the second slide, so one of the most common respirators used in healthcare facilities is the type of N95 disposable respirator. So this is one kind of N95 disposable respirator which filter out so this used to be called as dust, fume, and mist mask. So this mask protect the healthcare providers from airborne infections. An N95 filter belongs to a group of air purifying particulate filters. So it filters the different kinds of infections which is coming from the patients. So this is where this N95 filters are wear by the doctors and nurses. And this N95 filters is certified by National Institute for Occupational Safety and Health in the US. So there is one institution is there in US, that is National Institute for Occupational Safety and Health, which certifies this N95 filters for purifying the air purifying particulate, and it protects from the infections for doctors and nurses. And the N95 is one of the three types of filters. So in N95 we have three types of filters, so like N, R, and P. So this refers to the type of resistance they have to the degrading of their filtering efficiency. So these filters are divided into three types. These 95 filters are divided into three types, N, R, and P. So this refers to the type of resistance. So basing upon the resistance of their filtering capacity, so they are divided into N, R, and P. So filtering efficiency when exposed to different kinds of airborne particulates, mists, and etc. So whenever they are exposed to different kinds of infections, so these filters will plays a major role, that is N filter, R filter, and P filter. So and next, to help people remember which filters can be used for protection against different kinds of airborne particulates. So it is very important that people should know which filter is useful to filter for different kinds of airborne particles, like for dust. Suppose whenever you are going in pollution, so which kind of mask you should use. And whenever you are working in a chemical factory, so in order to avoid the chemical fumes or chemical smell, which kind of mask you should use. And next, whenever you are going in mist and fog, so which kind of mask you should know. So the people should know. So basically N95 is used for the healthcare providers for against the respiratory infections. So National Institute of Occupational Safety and Health provides the following guide. So whereas N stands for not resistant to oil, and next, whereas R is nothing but somewhat resistant to oil, and whereas P refers to strongly resistance to oil, that is oil proof. So we have three types, that is N filter, R filter and P filter. Whereas N filter is nothing but not resistance to oil, whereas R filter is nothing but somewhat resistance to oil, whereas P filter is nothing but strongly resistance to oil. So here the 95 N95 refers to the filtering efficiency. So N95 mask refers that it efficiently filter 95%, it filters the airborne particles. So there are three levels of filtering efficiencies in the market. 95% is nothing but N95, 99% is nothing but N99, and 99.7% is N100 or HEPA filters. They are tested against aerosol, fine mist droplets of 0.3 microns in diameter. So these filters have the efficiency of filtering the particles which are of 0.3 microns in diameter. And next, what is mean by aerosol? So these three types of filters, that is N filter, R filter, P filter, they are filtering the aerosol particles. So what is mean by aerosol means, an aerosol is a suspension of fine solid particles or liquid droplets in air or another gas. So it is nothing but, aerosol is nothing but a one type of liquid droplets in air or which is present in another gas. So aerosols can be natural or anthropogenic. So what are the examples of natural aerosols means? Fog, mist, dust, forest exudates and geyser stream. So these are nothing but natural aerosols. And what are anthropogenic aerosols? Are nothing but air pollutant and smoke. So aerosol is nothing but a suspension of fine particles or liquid droplets in air. Okay, next, basically we will use N95 type respirators, or the respirators recommended by the government of US, that is for Center for Disease Control and Prevention. So this N95 mask basically used by the healthcare workers when working with patients with infections that are transmitted from inhaling airborne droplets. So basically this N95 masks are used by the doctors and nurses when they are treating with the patients. And next, what are the examples where this N95 masks are used by the doctors whenever they are treating the patients of tuberculosis, and whenever they are treating the patients of SARS, that is severe acute respiratory syndrome, and COVID-19 virus. So N95 mask plays a major role for doctors and nurses whenever they are treating with the tuberculosis patient and SARS patients and COVID-19 patients. So it is nothing but a personal protective equipment for doctors. So this N95 masks are very important now while treating with the COVID-19 patients. Thank you friends. So that is the use of N95 mask. N95 mask is used by healthcare providers. So who are healthcare workers? Healthcare workers are nothing but doctors and nurses. So it will prevent the filtering of airborne particles. Whenever anybody sneezes and coughs, it will not enter into your nose and mouth. Okay, and I am showing you this is a photo of the N95 mask which filter out the airborne particles. Thank you friends. If you have any questions,